Imagine this: you're recovering from a serious infection in the hospital, thinking it's just a temporary setback. But what if that single event could dramatically increase your risk of developing dementia down the line? That's the eye-opening revelation from a groundbreaking study that urges us to rethink how infections impact our long-term brain health. As our world grapples with aging populations and rising rates of hospitalizations, this research sheds light on a potentially game-changing approach to dementia prevention. But here's where it gets controversial: could infections be the hidden culprit behind many dementia cases, or are we overlooking other factors at play? Let's dive in and unpack this together. A comprehensive research paper hit the shelves in Volume 17, Issue 10 of Aging US on October 13, 2025, with the compelling title, Hospitalization with Infections and Risk of Dementia: A Systematic Review and Meta-Analysis. This isn't just any study, it's a sweeping analysis spearheaded by lead author Wei-Yu Chua from the National University of Singapore, alongside corresponding author King Tan from the National Neuroscience Institute and Duke US Medical School in Singapore. Their work reveals that individuals admitted to hospitals due to infections face a markedly elevated chance of progressing to dementia. And with more of us living longer and infection-related hospital visits on the rise, this discovery couldn't be more timely, pointing toward fresh strategies to fend off this debilitating condition. To grasp the scope, picture a meta-analysis as a powerful tool where scientists combine data from multiple studies to draw broader, more reliable conclusions, kind of like piecing together a giant puzzle from smaller snapshots. Here, the team sifted through an initial pool of 1,900 studies, ultimately including 16 of them that covered a staggering 4,266,276 participants. This makes their review the most thorough examination yet on how infection-driven hospital stays might affect our brain's future well-being. The outcomes were clear-cut. Hospitalization for an infection boosts the overall risk of dementia by a whopping 83%. And this isn't uniform across all infections. Sepsis, which is a life-threatening response to infection that can overwhelm the body's systems, topped the list as the riskiest, closely followed by pneumonia, a serious lung infection, urinary tract infections, and infections in the skin or soft tissues. Interestingly, the study noted that the danger leaned more toward vascular dementia, a type tied to blood vessel issues in the brain, rather than Alzheimer's disease, which is more associated with protein buildup. But this is the part most people miss: the connection persists even after adjusting for factors like age, sex, and other health conditions, suggesting it's not just coincidence. So what's driving this link between infections and dementia? One plausible mechanism is that infections kickstart widespread inflammation in the body. Inflammation, in simple terms, is your immune system's natural defense kicking into high gear, releasing chemicals to fight off invaders, but when it goes unchecked, it can wreak havoc. These inflammatory substances might sneak past the blood-brain barrier, think of it as a protective shield around your brain, and spark problems like the accumulation of harmful proteins or the death of vital brain cells. This could be especially harsh for older adults, whose immune responses often slow down, making recovery tougher. The research also hints that just one infection-related hospital stay might accelerate cognitive decline, particularly for those already vulnerable, perhaps due to genetics or prior health issues. For beginners wondering about this, think of it like how a car engine overheats from overuse. The body follows similar stress patterns that can wear down the brain over time. Related stories. New models for evaluating risks might better assist patients who choose to leave the hospital prematurely, despite doctors' recommendations. https://www.newsmedical.net/news/risk assessment models could improve support for patients leaving hospital against medical advocacy ASBX. Researchers have identified genetic factors influencing bone strength and density in younger individuals, offering insights into long-term skeletal health. https://www.news-medical.net/news/2025-11119/scientists-uncover-genetic-components-link-to-bone-density-in-young-people.aspx. Damage to the heart in middle age appears connected to an increased likelihood of dementia as we grow older, highlighting the heart-brain link. https://www.news-medical.net/news/20511055/heart-damage-during-middle-age-life.aspx. The implications don't stop there. The heightened dementia risk peaks in the first year after an infection, but stays elevated for years, even decades. Studies tracking participants for over 10 years found even stronger ties, emphasizing the urgent need for close cognitive checkups right after hospital discharge, especially for seniors bouncing back from illnesses. This could mean regular brain health screenings, like simple memory tests or brain scans, to catch issues early. These discoveries carry profound weight for healthcare providers worldwide, particularly in regions with rapidly aging communities. They remind us that dementia prevention shouldn't focus solely on genetics or daily habits like diet and exercise. Infections must enter the conversation. Globally, over 50 million people live with dementia, and in the US alone, the annual cost of care surpasses $300 billion. By pinpointing preventable risks like infections, we open doors to smarter solutions, ramping up infection control in hospitals, enhancing care protocols, and vigilantly tracking brain function post-illness. Imagine, for instance, vaccines or better hygiene practices reducing infection rates, potentially slashing dementia cases. It's a ripple effect that could save lives and lighten the economic burden. But let's stir the pot a bit. Is the connection between infections and dementia causal, or could it simply reflect that people with underlying health weaknesses are more prone to both infections and cognitive decline? Some might argue that infections are just one piece of a complex puzzle, with factors like stress or medication side effects playing roles too. What do you think? Should we treat infections as a direct trigger for dementia prevention, or are we jumping to conclusions? Share your thoughts in the comments. Do you agree this is a breakthrough, or is there a counterpoint we haven't considered? Source: Journal reference: Chua, W. Y. et al., 2025. Hospitalization with Infections and Risk of Dementia, a Systematic Review and Meta-Analysis. Aging. doi 10.18632/aging.206329. https://www.aging-us.com/article/206329. Suggested reading. Terms. While we strive to provide accurate, edited, and approved content in our responses, occasional inaccuracies might occur. Always verify any details with the original sources or experts. Please note that we do not offer medical advice. For health-related queries, consult a qualified professional before making any decisions. Your questions will be shared with OpenAI, but not your email details, and retained for 30 days per their privacy policies. Avoid submitting inquiries involving sensitive or confidential data. Review our full terms and conditions here. https://www.news-medical.net/medical/terms